It goes against every mother's instinct, and yet Annette Corriveau wants to end her children's lives. What you are about to hear in this exclusive interview might sound disturbing, but this mother of two says no one can understand unless they watch, as she did, as her children succumbed to severe mental and physical disability caused by a rare genetic disorder. Now, as adults, her son and daughter are non-responsive and use a feeding tube. Were it not for modern-day science, the law of nature would not see their survival. But here, the law of a nation keeps them alive.
There are many pros and cons to assisted suicide that stem from both patients and loved ones.
A patient has full control of what happens to his or her life before, during, and after.
Although loved ones may not come to accept what's happening, they are not left with the burden of trying to control what happens.
In the arms of the angel, fly away from here, from this dark cold.
Know is that obviously we are all going to die, but how we die is actually really important. Obviously not just to us, but also to how that features in the lives of all the people who live on afterwards. How we die lives on in the minds of everybody who survives us. And the stress created in families by dying is enormous. And in fact, you get 7 times as much stress by dying in intensive care as by dying just about anywhere else. So dying in intensive care is not your top option if you've got a choice. And if that wasn't bad enough, of course, all of this is rapidly progressing towards the fact that many of you, in fact about 1 in 10 of you at this point, will die in intensive care in the US.
As stated, euthanasia, also known as assisted suicide, is illegal in most countries, including the United States. Although deemed illegal, a few states, districts, and counties have passed acts allowing for the process to take place. As of now, the state of Oregon has become the most common state to allow the process with its Death with Dignity Act, passed October 27, 1997.
The practice of assisted suicide is met by the completion of various requirements, such as the patient must be 18 years of age or older, a resident of Oregon, capable of making and communicating healthcare decisions for him/herself, and diagnosed with a terminal illness, usually cancer or ALS, that will lead to the death within 6 months. It is up to the attending physician to determine whether these criteria have been met.
Choices. We trained hundreds of people to go to the wards and talk to people about the fact that they would die and what would they prefer under those circumstances. They loved it. The families and the patients, they loved it. 98% of people really thought this just should be normal practice and that this is how things should work. And when they expressed wishes, all of those wishes came true, as it were. We were able to make that happen for them.
To have control over my own mind. To go with dignity is less terrifying. When I look at both sides, I have to die. I feel this is far more humane.
Once criteria have been met, the patient completes a written request and presents it to the attending physician. The physician then gives the patient a 15-day waiting period to think twice. After the 15 days, the patient must present an oral request in front of 2 attending physicians. If approved by both physicians, the patient is sent to speak to a psychologist for a mental health examination. If approved by all the physicians, the patient is prescribed a lethal dosage of a sedative.
I want to change the law because we don't allow our animals to suffer as we humans have to suffer at the end of life. It is too cruel for our loved animals, yet we can only watch and feel inadequate to relieve our loved ones' distress. Sadly, few people die gracefully in their sleep.
And when a patient...
We want choice!
I don't want to hang myself. I don't want to shoot myself. I don't want to jump off a bridge. I don't want to run in front of a train. Because that's suicide. This is not suicide. What I plan to do. It's totally different. It's going out with some dignity.
Euthanasia is the voluntary termination of life in order to relieve suffering. It is a doctor-assisted act which would allow patients to pass on, potentially in the privacy of their own homes and definitely surrounded by their loved ones. To leave this world with dignity intact. Is that not something we should aim for?